Hi guys, my bacteria is Treponema pallidum, which causes syphilis. So why do we care about this disease? So syphilis is a sexually transmitted disease that can start with genital sores around the vagina, anus, rectum, or in and out the mouth, and that it can of course occur during anal, vaginal, or oral sex. If not treated, it can cause serious health problems. It could also cause problems with pregnant women. They can have miscarriages, stillbirths, or the baby's death shortly after birth. So, syphilis is an ancient disease. However, an estimated 55,000 people in the United States get new syphilis infections each year. So, the classification of my bacteria is the kingdom is a eubacteria, domain bacteria, the phylum is a Spirochaetes, as well as the class. The order is the Spirochaetales, the family is the Spirochaetaceae, the genus is Treponema, and the species is T. pallidum. The history behind its nomenclature. So, syphilis originated from a poem called Syphilis Cymorphus Gallicus, and that was by an Italian physician poet named Girolamo Francesco. And this was in 1530. So the poem basically tells a story of a shepherd named Syphilis who blamed and insulted the sun god for the drought that has brought them to the demise of his flock, and in return they received the punishment of the horrific disease syphilis. So how is syphilis spread? So syphilis is spread to person direct contact with the syphilic sore, known as the canker sore. So this can happen during vaginal, anal, or oral sex, like stated in the previous slides. It is a communicable disease. If you're pregnant with syphilis, it can be passed down to the baby as well, where the newborn can die from the infection, or if the baby survives, it can cause lifelong problems. So my peer-reviewed article is effectiveness and tolerability of oral amoxicillin in pregnant women with active syphilis. In this article, they basically conducted a nationwide study in Japan. They tested 80 pregnant women with active syphilis. So 21% had pregnancies resulting in CS, which is congenital syphilis. 3.8 changed therapies due to side effects. 26 with early syphilis had 0 cases. 45 with late syphilis had 15 cases. And then 57 who started treatment 60 days before delivery had 8 cases. And here are the results. The result table is up here. In conclusion, they found that oral amoxicillin is potentially ineffective for preventing CS cases among pregnant women with late syphilis, but it could potentially be effective for those that have early syphilis. So the frequency of occurrence. Each year, there are about 6 million new cases of syphilis globally in ages 15 to 49 years of age. It is a re-emerging disease. After the first outbreak in 1495, the disease rapidly spread to other continents, and that caused a global pandemic. When the penicillin came along, it decreased the number of cases drastically. However, the infection with the bacteria has been re-emerging globally in the last few decades. So, the mechanism of pathogenicity of this microorganism is T. pallidum attaches this mice through and invades the host tissue. So these bacteria attach to a variety of host cells types by interacting with different host membrane components. Its spiral shape allows it to enter through breaches of the skin and swim through gel-like substance like mucous membrane to gain access to host blood and lymph tissue. So the diagnostic signs and symptoms. So the way we test for syphilis is through blood samples, and this can determine your current or past infections. So there are 4 different stages in syphilis with different symptoms. First one being primary, which is 1 or more painless, firm and round sore of canker, and those can appear about 10 to 3 months after the bacteria has entered the body. Secondary is sores that resemble genital warts, so a non-itchy rash, muscle aches, fever sore throat, swollen lymph nodes, patchy hair loss, headaches, weight loss, and fatigue. And then Latin, this is the phase where your body's going to basically harbor disease, so you're not going to show any symptoms. Tertiary is at this stage, it starts to damage the organs. So this is like your heart, your blood vessels, your liver, your bones, your joints, and then once it reaches the stage, it can cause death. So the treatment of this disease, so syphilis is easy to occur in early stages, such as the primary, secondary, and early. And this is through injection of a long-acting penicillin that can cure only the early stages. So The prevention methods would consist of the use of protection, such as condoms, getting tested often, using dental dams, and to make sure your partner is tested. There's still an ongoing debate in where syphilis first originated from, but many believe it originated in southern Western Asia around 3000 BC, where it then spread to Europe. Many also believe it came from Columbus and the sailors that brought it to Europe. Thank you for watching.